Hello, this is Dr. Neil Baum from New Orleans, and I'd like to take about 6 or 7 minutes to talk with you about some options besides practicing clinical urology. I'm sure you can recall when driving a car that you used your GPS to help you on your route. Occasionally, you will miss a turn and you will hear the app say, recalculating route. Well, that same situation happens in a medical practice where there are situations that occur that require us to recalculate our route. So this video will cover why we need to think about the possibility of recalculating our route and give 5 examples in addition to clinical urology that you might consider. So why consider recalculating your route? Well, reimbursements are decreasing, overhead costs are rising, physicians' incomes are stable and decreasing, hospitals are employing physicians in record numbers. We are losing our autonomy. We have more burnout than ever before, and we have more pain points. I've listed some of the pain points in this slide. Hopefully, we don't experience all of these pain points, but I'm sure there are several there that you can identify with. COVID-19 has provided us with some new opportunities. It is said that the Chinese symbol for crisis is exactly the same as the symbol for opportunity. So here are 5 career suggestions outside of clinical urology. One is to become a medical educator. Physicians are used to being teachers. We would be attractive to teach medical students, residents, and fellows after we leave clinical urology. Also, it's an opportunity to do international travel and practice in other countries, especially English-speaking countries such as Australia and New Zealand and South Africa. I suggest if you're going to do this, find a mentor who already is a educator and find out what process you need to take in order to become a educator. Second, the pharmaceutical industry and medical manufacturing is always looking for physicians who can provide advice and their clinical experience. If you have had experience doing clinical research in your practice, this is a real plus for being hired to manage a clinical trial. Number 3 is participating in the legal community and serving as an expert witness. And there are large numbers of attorneys who are looking for experts regarding personal injury and malpractice claims. I think it's always easier to work on the defense of a colleague than on the representing the plaintiff of a malpractice situation. And you can also give advice to attorneys, letting them know if they have a good case and charging them by the hour for your work. Another opportunity is becoming a medical appraiser and determining the value of a physician's practice. This can be either related to their equipment that could be for sale or the real estate value. This usually requires some on-the-job training and shadowing of an existing appraiser. And 5, and finally, is become a medical writer. You can be paid for writing blogs and newsletters and providing medical content for physicians' website. It doesn't require any additional training or equipment. All you need to do is submit some samples of your writing with your resume. Also, you might consider becoming a nonfiction writer. Two urologists who have become fiction writers are Dr. Jim Gottesman from Seattle, Washington, and Dr. Stacy Childs in Steamboat Springs, Colorado, have both written several books in the nonfiction, in the fiction category. So the bottom line is that just because you are not going to practice clinical urology doesn't mean that you can't recalculate your route and finding alternative of things to do outside of clinical urology. I hope you found this video helpful and useful. If you'd like a copy of my paper on recalculating your route, kindly contact me at the email address shown on the last slide. Thank you.